Clinical Trial Protocol Defined by Dr. Mark Heran and Dr. Stuart Goldman at the ISPNO Family Day Panel Discussion, July 2008.
Can you explain what the protocol means?
So there are different types of protocols. Usually we refer to them as experimental, and experimental I know sometimes has a negative connotation. But the way things are designed is until we have a pill that your child swallows and the tumor disappears, never comes back, and has no toxicity, no one is completely satisfied with where we are. So we have a number of relatively effective therapies that can cure the vast majority of patients, for which there are still protocols going on that are designed not to improve the cure rate, but for example to reduce the toxicity rate. And obviously whenever you make a change in a therapy, you have to be sure that that change both achieves the goal, reduces the therapy or improves the cure rate. And the way you design those is by what's called a protocol. And so a protocol is where every patient being treated has a disease that is meant for this therapy that comes into the treatment, whether it be newly diagnosed or relapsed, depending on the question you're asking, but that everyone is the same, everyone gets the same therapy, or if it's a trial where half the patients are getting one therapy and half are getting the other to see which one works better or is less toxic. But at least all of those things are standardized in advance. You then have an opportunity when the study is done to actually look at the results and say, yes, with confidence, this was better, or this is less toxic and equally effective, and that's how we move forward. And the way we do that is a protocol. And protocols are important. In fact, many of the results reported at this meeting is the oncologist in the room knew the answer until the study showed us that in fact our impressions were wrong. We were guided by a couple of cases that went one way or another that didn't reflect what really happens. And so the way we all learn is to do that. And it's obviously hard for a family to go to a doctor and be told, listen, we're not absolutely sure whether what we are proposing is right or wrong, is good or not, is better or not, is equal or not. And the way we do that is through these things called protocols. And so it's very important to understand when you go on a protocol, whether it be a novel therapy, a standard therapy, a less toxic therapy, you're helping us and every future patient answer that question. But since you're part of answering the question, if you're looking at your doctor to tell us, well, just tell us what the answer, like tell us which one is better, which treatment, if we already knew that, we wouldn't be doing the study in the first place. The one thing we can tell you is in pediatrics, we don't do studies where one of the groups is getting nothing or some fake therapy. We don't do that. We only do things where either people are getting what are thought to be equivalent therapies and we need to find out whether they're really equivalent or not, or if there is no standard therapy, they're only getting one treatment being offered.
I can't tell you how any more strongly than Mark has said about how the importance of research protocols. And I think I speak for all of us that it is our goal for every single child we care for to be part of a research protocol. And some of you in the audience may have not, because we don't always have protocols open. But I believe part of your question really is, what's the difference between a phase 1, a phase 2, and a phase 3? So if there's a nod of heads, am I getting that? Is that the question you want answered? Okay. So a phase 1 officially is a toxicity trial, where we're taking an agent that we may not have used in children in the past, and occasionally, but rarely, not even been used in humans. And in consecutive groups of patients, looking at what is the maximum tolerated dose, or what is the dose where we start to have toxicities that limit its use. That is clearly stated, but that is not the reason any parent would put their child on a trial, and we know that. So in those trials, we are only offering those where there will be imaging and other criteria that if it's not helpful to your child's future, that we would not continue that therapy. So though it is a toxicity trial, they are all written with those safeties. And those aren't trials we use up front or the first time a child's been diagnosed, unless there is no known therapy that is curative. A phase 2 trial is for particular tumor types where we're looking to see if it works, if it's efficacious. And the third type, our phase 3, is when we're actually comparing two treatments to see which one is better. And that's really some of the terms that we throw around each other that sometimes we don't take enough time to explain.